Good afternoon. Warm welcome to this unique program of Ahmedabad Management Association. And the program is about integrating the precision of allopathy and the wisdom of Ayurveda into our health and wellness. That's the unique program of AMA. I am very happy to see you over here on a Sunday afternoon. And when the cricket match is going on in Gujarat, to have people interested in this program is a big challenge. So again, once again, warm welcome to this program. I'm Dr. Dhiren Ganjwala. I'm an orthopedic surgeon, but we at AMA organize a lot of public awareness program for the various topics on health. And usually we do that those programs in Gujarati, but for a change, this program will be in English. So let me give you a background about this program. Few months back, my college friend, Dr. Amit Shah, who is now at USA practicing over there, called me and told me that Dhiren, one world-renowned authority is coming to India, and you should take this opportunity to invite him to Ahmedabad and have some public awareness program. So I was like, I have never done such program. So I was in dilemma whether I should take this challenge or not. But then I consulted or asked my friend, Dr. Prerak Shah, who is an Ayurvedic consultant, and asked him like, should we do such program? And he said that, yes, we should do it, and we should do it at AMA. And because of all this, we are able to carry out this program. Now, the most important thing, I always look at the society into two broad categories. The one group of people are always committed to one branch of medicine. It may be allopathy, it may be Ayurveda, it may be homeopathy. And they are committed to that specialty. But there are other group of people who are broad-minded, those who are flexible, and those who are open, and they are ready to take best of both the worlds, and they are really keen to have something which is good for their health and wellness. And today we are going one step further, and we are going to integrate this, and by this we are going to get the best of both the worlds. So that's the aim of this program. Now, before we invite our speaker, I would request Himani Ben, and I would ask Dr. Prerak Shah to felicitate our guest, the esteemed speaker, Dr. Charles Elder. Sir, yeah. Yeah, Dr. Elder. And I also would like to appreciate and thank my college friend, Dr. Amit Shah, who is actually the man behind this program. So Ahmedabad Management Association would also like to appreciate your efforts. So I request Dr. Tiven Marwa, he is an endocrinologist, to felicitate Dr. Amit Shah. Yes, so without taking much time, now I request Dr. Amit Shah to introduce our today's esteemed speaker, and he will tell that why this topic is important in the present scenario and how we are going to take this forward. So, Dr. Amit Bhai, please. Thank you once again.
Hello, good afternoon. Lot of familiar faces. But look at the destiny. Dr. Marwan, actually, we go back more than 40 years. He actually was my senior resident. When I started my internal medicine practice, my first semester, he was the supervising physician for me. So thank you, Dr. Marwan. So on behalf of API Ayurveda Consortium, I really want to thank AMA to let this unique historic event happen actually. And I will suggest and explain why this is historic event. But I want to thank Dr. Ganjwala, Dr. Joshipura, Dr. Preraksha to help in organizing this event. Of course, I want to introduce Dr. Charles Elder. I want to introduce him in a very different way, actually, which includes the also explanation about the purpose of this event and why we have a opportunity to bring him here. And it goes back to a simple Vedic sloka, which actually explains the real definition of health and well-being. And if you all can join with me, and I'm sure some of the Ayurvedic physician knows this sloka, which is called Samadosha Samagni. Come on. Samadhatu Malakriya. So Samadosha Samagni means the balanced bioenergy, balanced metabolism, Samadhatu balance all the body system and all the excretory physiology processes. The second sentence, Prasanna Atmendriya Manaha. So Prasanna is bliss. You can call it Anand. Atmendriya Manaha means bliss, mind, body, and spirit. Swasthya iti abhidhyate. Swasthya adi abhidhyate. Swasthya means health. But think about, we talk about personalized well-being today. The actual meaning of swasthya, swa and astha. Swa, which is astha. Astha means balance. Swa means personal, personalized well-being. It has been embedded in the definition of well-being by Ayurveda for centuries. We talk about personal well-being today, but this has been a personalized well-being life science for centuries. Now think about the powerful scientific relevance of this mantra and how that power touches Dr. Charles Elder when they were in medical school. So Dr. Elder and Leslie Elder, they were in medical school, very much stressed out, and they were looking for a peace of mind. And guess what? The meditation, the transcendental meditation program in their medical school, they are actually exposed for the first time. And from that onward, the more and more benefit they saw from the meditation program, and they went into the Ayurveda. So even after becoming graduate, and of course, he is actually graduated from world-renowned medical school, Boston Medical School. And then his residency program in internal medicine is in University of Michigan. And after that, he has been with the one of the biggest healthcare system for 30 years. But what he does there, he introduces the alternative, the complementary medical modalities, including transcendental meditation and Ayurveda. At the time where Ayurveda was the word, the new word for every American, he will have to explain what Ayurveda is. But he will continue to do this journey for so many years, almost close to 25 years. And then he was gradually exposed to the Maharshi International University also simultaneously because of his TM training and program and whatnot. So lately, in last 5-10 years, he has been more and more involved in the Maharshi Ayurvedic University, and he doesn't end there. He keeps pushing the envelope because he believes in it. And not only he believes in it, he actually practices day in, day out to his patients. So it's about the power and the relevance of Ayurveda, which is bringing all these different events which we have been doing for last 1 week together, because it's not about our passion and because Ayurveda is our heritage and therefore we have to do it. No, it is a relevant Vedic science, and it can be very easily integrated with the modern medicine. In fact, we don't have much time, but one of the talk I gave 2 days ago where we compare the scientific foundation of modern medicine and Ayurvedic medicine. And they are matching so much that sometimes you will not understand where we are, whether are we in the modern medicine or Ayurvedic medicine. But anyway, coming back to Dr. Charles Elder, he is actually executive director of a unique integrative Ayurvedic fellowship, which is a 2-year program after the internal medicine residency. And we have partnered with the University of Arizona. So he's the executive director of that, and now he's actually board of chair at the integrative department of MIU, which is the Maharshi International University. I would not take much of your time, but let's join me in welcoming Dr. Charles Elder.
Thank you. Can you hear me? Yeah. Good, is that good? In back, can you hear me? Good? Can you hear me? Okay, very nice. Thank you, Dr. Shah, for that wonderful introduction, and to all of you for taking time to come out to talk about integrated medicine and Ayurveda, state of the science, and on behalf of all of our faculty at Maharishi International University, it's just wonderful to see all of you here. And if you don't know, you should know that we at MIU are committed to this mission. This is what our university is about, is integrating, bringing Vedic science alive into the lives of our students. And in our case, we have a fellowship program. Our students are doctors. So we'll talk about that in a bit. So these are some of the topics that we can talk about today. I'll come down here if you don't mind. Why are integrated medicine and Ayurveda relevant for allopathic doctors? So we can talk about that. Number two, what do the evidence-based and research environment look like? Is there data? Where's there data lacking? Where's the funding coming from? Where's it not coming from? And the like. What practice models are compelling? How have I introduced Ayurveda into a clinical primary care practice in the United States? How have other people done that? And what does the training environment look like? The medical legal environment look like? A little bit about our fellowship and like that. So those are some of the topics that we can address, and we've got a couple of hours almost, so we'll have a nice discussion.
Too fast.
I'm talking too fast. I'm going to talk slower. So I just said this. That's what I said really fast, okay? So I'll talk very slowly. Thank you very much. So first, I hope this isn't boring, but we'll talk about some definitions because people use a lot of jargon when discussing this topic. So when we talk about conventional medicine, we're talking about allopathic medicine, conventional medicine, pharmaceuticals, surgery, etc. Now, some of our patients are interested in alternative medicine. By alternative medicine, we mean personally, I'm not a fan of alternative medicine because alternative medicine, what we mean is people are doing some non-mainstream thing instead of conventional medicine. And that's not really how I like to practice, because what we're talking about doing is taking the best of both worlds and merging them together. So complementary medicine is we've got conventional medicine, and then we take something else that the patient or the doctor is interested in, Ayurveda or acupuncture, whatever, and we add it on. Okay, so now the patient's doing two different things. Integrative medicine is when we take those different things and do them in coordination. Okay, Ayurveda, you know what that is. It's the traditional indigenous healthcare system of this country, the great Vedic tradition, land of the Ved. And an integrative, when we talk about integrative Ayurveda, we are talking about using Ayurveda side by side with conventional medicine for the benefit of the patient, taking the best of both worlds. And then there are many other types of, or styles of integrative medicine. There are many other types of complementary medicine. There's Chinese medicine and functional medicine and homeopathy and the like. Any questions about that or comments? Okay. So why do doctors in the United States, and I would assume in India and everywhere, care about integrative medicine? Talk about integrative medicine broadly, and then we'll talk about, well, within integrative medicine, why would someone training at the University of Michigan who's an internist be interested in Ayurveda specifically? Well, okay. So one of the reasons that in the United States, people are, we'll look at some data from India as well, that there is interest in integrated medicine as doctors, because the patients are demanding it. Patients are using integrated medicine more and more. So this slide is, come over here. This slide is from the National Health Interview Survey. This is a national survey in the United States, asking people about various health practices. And we're looking at utilization of different types of complementary medicine. Now, we won't see Ayurveda here. It's not really well documented. And these surveys don't ask about Ayurveda. But here we can see, I'll show you. So for example, for acupuncture, and what you can see is that there's 2002 data, 2012 data, and 2022 data. And we can see that about 1% of the population was using acupuncture in 2002, and now it's 2%. And the point of the slide is that this keeps going up, right? So that chiropractic care in the 2022 data, 12% of Americans were using chiropractic care, 17% meditating, yoga up from 5% in 2002 to 16% in 2022. 22, like that. If you lump it all together, the survey data usually suggests about 35–40% of Americans are using some form of integrative care in any given year. Okay, so these are data that I published with my colleagues about 10 years ago, and we sent a survey out to all of the patients at Kaiser Permanente Northwest. That's 500,000 people in the company, in the health plan, and there were about 25,000 of them who met an electronic medical definition of chronic pain. And we sent them a survey, and we got about 6,000 responses, and we learned that about 60% of our patients with chronic musculoskeletal pain were using acupuncture or chiropractic care. And then the point of this slide is if you look here, okay, so it's hard to see the slide, so I'll tell you what it says, that about 35 to 40% of the patients who were using chiropractic or acupuncture didn't tell their doctor. So there's this silent thing going on in the background that the doctor doesn't even know about. Does that help? That helps. Okay, thank you very much. Okay, utilization patterns in India. This is a paper published by Mohanty and colleagues in the journal Sirius in 2024. And this is from the a longitudinal aging study in India, a large cohort, and people were asked about their use of healthcare. And we can see here, I hope you can see. Well, so that about 27% of people in this country didn't, in that year, didn't consult any healthcare practitioners. Allopathic doctors, a little over half. And we can see here that a little over 7% of survey respondents had consulted an Ayush practitioner of some sort in that year. Right, Ayush, Ayurveda, Yoga, Unani, people, homeopathy, yeah, cities, okay. Okay, so that's one reason that doctors are interested in integrative medicine more and more is because their patients, our patients are interested in integrative medicine more and more. Okay, another reason is because of the burden of chronic disease. So there is a burden of chronic disease which is not getting better, and in fact is getting worse, so all hands on deck. What we're doing isn't quite cutting the mustard, so we need more help. So these are data published by Hacker in the Mayo Clinic Proceedings in 2024. And here we're looking at the number of elderly citizens who have Alzheimer's disease in the United States. And this is where the pointer is data from 2000. And here's data from 2020. So 6.1 million people up to 8.5 million people with the projections to 13 to 14 million people by 2060. So the incidence of Alzheimer's disease is going up in America. Okay, and it's the same story for other chronic diseases. Here we see that about 13% of Americans have diabetes. That's as of 2018, 2020, up from 10, 11% at the turn of the century. Chronic musculoskeletal pain. These are data from morbidity and mortality weekly reports published by the Centers for Disease Control. And you can see here that 22% of people, that's 2019, 2020, 2021, little over 20% of Americans have chronic musculoskeletal pain. It's hard to treat. Opioids don't work. Okay, so there's another reason that doctors are interested in integrative medicine is that the burden of chronic disease, and we're blowing it. It's not, we're all hands on deck. So we need more integrative care. All right. Allopathic care is dangerous. That's another, potentially, not always, but drugs can be dangerous. Surgery can be dangerous. So here we see, this is WHO data from the World Health Organization. About 1 in 10 patients experiences some sort of harm in an allopathic hospital. 15% of health spending is directed toward managing adverse events from allopathic care. And we all know this in our practice. We spend a lot of time fixing mistakes that we've made or unforeseen bad outcomes. Okay, allopathic care is expensive. We need less expensive alternatives, and that burden of chronic disease is expensive. Okay. This is a very interesting slide, and you won't be able to read that data. I'm going to tell you what it says. A lot of physicians, well, a lot of the reasons why physicians are interested in integrative medicine are because of their own personal experience. The reason I became interested in Ayurveda as a practitioner is because of my own personal experience as a meditator and as a patient. And then the data were important, but what drove me was my own experience. And what we see here is very interesting. What this slide tells us is that healthcare workers actually use complementary and integrative medicine at a higher rate than the general population, which I thought was very interesting. And here, okay, about overall CAM use, excuse me. Sorry, I can't read it either. So overall complementary integrative medicine use, 75% in this survey, 75% among healthcare workers versus 62% among the general population. And within healthcare workers, doctors and practitioners were using it more than the support staff. Okay, that's pretty interesting. So doctors were using complementary integrative medicine more than the medical assistants and the nursing staff. Yeah. Okay, yet another reason that we're interested in integrative care is that, as we've already suggested, there are lots of conditions for which allopathic care simply doesn't work. Now, don't get me wrong, I well understand that there are lots of conditions for which allopathic care does work, but there's a lot where it doesn't. This is a graduate student of ours at MIU who had just had this thesis proposal approved. So this clinical trial is going to actually be done in India. It's going to be a 12-week yoga and Ayurvedic program for children with autism and their families. I mean, why not? It is a very difficult population. Anything we can do is, yeah. Okay, we can learn from Ayurveda how to better engage our patients. One of the ways that we do that is by taking their pulse through pulse diagnosis. And as integrative medicine practitioners, we find in America, we find paradoxically that when we start talking to patients about integrative care, they start to trust us. So sometimes people will go to an oncologist and the patient has breast cancer, which can be treated with surgery, radiation, whatnot, and they won't do it. They won't do it. And then they'll come to us because they want alternative care. And when we honor their views, and they see that we respect their culture. Often our clinic will be the people who can convince them to go do what's going to work, the conventional care, alongside the integrative modalities. Now, so we talked about integrative medicine in general, but why Ayurveda? Well, Ayurveda has a long history of use. In the allopathic community, history of use is downplayed. But in allopathic medicine, there isn't much history of use. Ayurveda, 3,000, 4,000 years, that is a lot of anecdotal evidence. You can't just dismiss it. And it is textually based. So this is very important. And it is consciousness-based and holistic. Charaka Samhita, as you know, Charaka Samhita, what, 2,500 years old in writing? Something like that. And at the end, Ayurveda is consciousness-based, meaning that it seeks, the goal isn't simply curing a particular disease, but the full evolution of the patient, mind, body, and spirit. And Ayurveda provides the allopathic doctor who comes to our fellowship program to learn it with a new explanatory model. Because patients come in, I'm a primary care doctor, patients come in with these constellation of symptoms which you can't make heads or tails out of from an allopathic. I'm constipated and I'm anxious and I have a headache. And so the allopathic doctor, that's 3 diagnoses and 3 prescriptions and 3 workups. But we can, in Ayurveda, balance of the doshas, ama, agni, these different concepts which provide us with a new lens through which to look at the patient and often to improve their care. Okay, so those are a number of reasons why allopathic doctors are interested in integrative care, in addition to clinical evidence, which we'll talk about in a second. But I'll take a break and see if there's any questions or comments on any of the slides or anything I've mentioned so far. Yes?
For the very interesting information.
Oh, I know.
Yes.
Yeah.
I'm Shivan. Thank you very much for the interesting information. I was just wondering that neither US FDA nor any legislative or medical practice licentiate authority of USA has approved Ayurveda. So what is the form of Ayurveda that is practiced in USA currently? Number one.
Okay, very good.
And what are the modalities, the therapeutic modalities, not the therapies, but the therapeutic modalities that is available? Because as I have been in the trade and business for 30 years in international business, my understanding about the US market is that, again, the traditional the Ayurvedic formulation are not Ayurvedic medicines as for US FDA. They are labeled as health supplement, food supplement, or wellness medicines, and most of them are single herbs. Third thing is Ayurveda principles basically works on the doshas, as you rightly said. So how this education and training is imparted in USA as far as the pure Ayurvedic concepts, practice, and skills to diagnose. When I say diagnose, again, as far as I understand, the Ayurveda falling under CAM in USA, the practitioner is not supposed to diagnose, not supposed to treat any disease through that system of medicine. So there is a lot of complexity, which I think you can well explain.
Yes, thank you. So I'll start that. You've raised a lot of very interesting issues, and I'll talk about it for a while and then give you a chance to make sure I answered your question correctly. So the landscape in the United States is very complex around this. 50 states, 50 different sets of rules. So I'll tell you what we're doing at Maharishi International University, which is the largest center for Ayurvedic training in the country, in North America. I'll be very transparent about it. We have a master's program in Ayurveda, which is 3 years long, which is intended to train Ayurvedic practitioners. And to enter that program, one needs a bachelor's degree, 4 years of college. Okay, so then people come out, and then in theory, and then people come out of that program, and they can potentially become Ayurvedic practitioners. So, well, hang on a second. You are correct that there is no legal certification for Ayurvedic practitioners. There are some organizations which have purported to represent the community as being the certifying body for Ayurveda. So, for example, there's a National Ayurvedic Medical Association you may have heard of, which has a certification exam which one can sit. Okay, so let's say someone goes through that program and then they take the NAMA exam and pass. All right. There are in the United States some states which are health freedom states, where the state legislature, there are 20 of them, I think. Might be less. I think it's 12. I take it back. I think there are 12. It's a minority of states where state legislatures have passed laws which make it a little easier for someone who isn't licensed to practice, say, Ayurveda. But it's a little risky. Now, what are the modalities that are being taught? Diet, daily routine, herbal supplements, mind-body, aromatherapy, pulse diagnosis, like that. And those practitioners are not being taught to administer pastis. They're being taught to Virachana, maybe, home Virachana, some Panchakarma, but not full-scope Panchakarma. Okay, so that's at MIU for that program. There are some competing programs which train Ayurvedic practitioners in other ways. The whole area of certifying Ayurveda practitioners in the United States who are not otherwise licensed is, as far as I can tell, a mess. There are several competing organizations back and forth. Not so clear what the status of that is. Most people are not going to get into trouble doing diet, daily routine, take the patient's pulse, some supplements, a lifestyle, some herbals, okay. But it's a difficult area for someone to earn a living. Health insurance won't cover it. Now, what we are doing at our university in the program that my wife and I, Dr. Leslie Elder, are running is we have a program for people who are already licensed practitioners. So our program focuses on MDs and DOs, medical doctors and osteopathic doctors, but also accepts nurse practitioners, physician assistants, chiropractors, naturopathic doctors, any other, and one or two other categories of license. People already have a license, because then what we teach them they can do because they have a license, they have another license. Okay? And what are we teaching them? The same sets of modalities, very basic stuff, mind, body, daily routine, diet, herbals. We teach them pulse diagnosis, aromatherapy, and the like. And this, for the practitioner who already has a license and already has allopathic expertise and already has learned how to take care of patients and has experience, can be a rich addition to the practice. And again, we're teaching some outpatient amapachana and virachana, but not, our graduates are not being trained to administer bastis or to do panchakarma. There are a handful of panchakarma centers in the United States that are very professional. At MIU, on our campus is the Raj, where we have Vaijas and lots of experience doing panchakarma. And it is physician supervised, and it's a little dicey, the medical legal environment for that. There are other places where they do panchakarma, and there's a range of things that go on. But there are 2 or 3, there's the St. Lad Center in North Carolina, 2 or 3 sort of famous centers where I would send my patients, but the landscape is not well regulated. Have I answered your question? Partly. What else?
I was focusing on the therapeutic aspect. How do you integrate the therapeutic care of the medicines in integrative medicine?
So the question was, how do we integrate the therapeutic remedies?
The question is, how do you integrate the therapeutic medicines of Ayurveda into integrative care? Because as you rightly said, and as I understand, the Ayurveda medicine is the classical Ayurveda medicine, not single herb. They are not allowed or permitted or licensed as Ayurvedic medicine by US FDA. So they are not being imported as medicine because many of my patients,
I understand.
they find a lot of trouble in getting some of the simple Ayurvedic medicines in USA.
Right. So that's a very good point. So we do the best we can. Now, there are some quality supply. So how do we integrate the modalities? We integrate the modalities. So we're seeing patients, and we're taking care of them. We're giving them ibuprofen and getting MRI scans and doing what we're doing. But if we deem it appropriate, we can add an herbal supplement and give them some dietary advice and some home remedies and the like. Now, as far as the supplements go, you are correct that they're not regulated as medications. And there can be challenges bringing forward, getting some of them into the country. But not everybody has those challenges. In other words, there are some companies that bring high quality Ayurvedic herbal formulations, including classical formulations, into the United States. So for our practitioners, we have 3 companies that we recommend: Maharishi Ayurveda Products International, Kotakal USA, and Banyan Botanicals. And those are 3, Banyan Botanicals is USA based, those other 2 are international. And we're comfortable with their quality controls, and they've been able to bring products into the country. And so we are able to get those. And as an allopathic doctor, you can use your license, and in your judgment, it's the best thing to do. It's okay. It's a little bit tougher for us because when there is a combination formula, it's a little riskier if the patient doesn't do well and we get blamed. Then it's a little riskier as opposed to if I prescribe Brahmi and the patient doesn't do well and I get blamed. Well, actually, well, here's the side effect profile of Brahmi. It's pretty well established, and it was perfectly like that. So it is.
Dr. Elder,
Yeah,
can
yeah.
you like complete your lecture and then we take the interaction? Otherwise, like it would be like we are diverting from your lecture and
Yes, okay. No, very good. Okay, so we'll move on. Thank you for your excellent questions. Thank you. Okay. All right, so we'll talk, let's talk about some of the evidence base that we have in the United States and the type of research that's available. So there's a lot of data on single herbs and very little data on mixtures. So that ties in nicely with the discussion we were just having. So in this slide, we're seeing data that was published in 2021. It's a meta-analysis data on ashwagandha, with the outcome being physical stamina. Does ashwagandha improve physical stamina? And they found about 11, I think, good studies, and they merged the data. And this is a forest plot. I don't know if you're used to looking at these. People post these when they do meta-analyses. And, oops.
No, you have probably pressed the blank.
And you can see here, here's this horizontal line, and you see this diamond, this green diamond to the right, I'm sorry, of the vertical line to the right, and that suggests that the combined data showed an effect for ashwagandha. Just this is one example. Ashwagandha has been studied for a lot of things. Many of the single herbs have been studied. Loads of data on the single herbs done in the West, well studied. But very little data on the herbal formulations, as we were just discussing. This is data from a scoping review that was recently published on Maharishi Amrit Kalash. It's a classical combination formula. They found 10 preclinical studies and 3 clinical studies suggesting use in cancer care. But there's not a lot of data on the formulations in America. There is a lot of data on mind-body techniques, and in particular, the transcendental meditation technique has been well studied. So TM has been shown effective and has been well studied. Lots of conditions. Most of the data is in the area of mental health and cardiovascular disease. And the data on the slide here are from a study that was actually funded by the Defense Department of the United States and was carried out at a Veterans Administration hospital in San Diego, comparing TM to, this is for veterans with PTSD, with post-traumatic stress disorder, comparing transcendental meditation to prolonged exposure therapy. That's a type of psychotherapy, which is standard care at the VA, to simple patient education. And we see here that the TM was best. Both the interventions were better than health education. And TM, there was a trend for the TM being better than the prolonged exposure, which is the standard care. So TM has been shown for substance abuse, for depression, for anxiety, for PTSD, well studied. And all of our students at Maharishi National University learn TM, including all the doctors. That's right. There's a lot of data on TM and cardiovascular disease, and these are data published by Robert Schneider and colleagues about 10 years ago, comparing transcendental meditation to health education in the setting of cardiovascular disease. And TM was found to significantly reduce risk for mortality, MI, myocardial infarction, stroke. These changes were associated with lower blood pressure. And you can see that the TM, the TM group, which is a green group, had a higher percentage of people without any events over 9 years. Okay, compared to control. Okay. There's a lot of data supporting lacto-vegetarianism. And that's a healthy diet, and that's been well studied. So these are data that were published in 2005 from the participants in the Swedish mammography cohort. 55,000 plus women. And what we see here is that lacto-vegetarianism, they're self-reporting their diets, lacto-vegetarian diet was associated with about a 50% risk reduction in obesity or overweight. And there's also more data on this. This is just, again, we're just taking a little survey. Reduced cardiovascular disease, reduced diabetes, and reductions in some types of cancer. Okay, there's loads of studies on yoga that have been done in the West, and yoga is very popular. These are data that were published by Karen Sherman and Dan Churkin at Kaiser Permanente in Seattle, comparing yoga to stretching to health education. And these top graphs are disability going out to 26 weeks, and the top line is the health education group. Both of the intervention groups, you can see, are significantly lower, showing a significant effect for both of those interventions, including yoga. And there's loads of data on yoga in the setting of back pain and the like. Okay. In Ayurveda, we have a science of dinacharya, daily routine. We should do certain things at certain times of day, right? The sun represents Agni in the universe. The energy from the sun is a source of growth, dynamism, and evolution everywhere in nature. Jatar Agni, the digestive fire, represents Agni in the individual physiology and is a source of all transformation and metabolism in the physiology. So we have this ancient Ayurvedic science that for however many years has been explaining to people that you should have your main meal at lunch, get to bed by 9 or 10 o'clock at night, get your exercise in the morning, don't exercise during your lunch hour, and don't eat late, and sleep at night, not during the day, and work during the day, not at night. Okay, but this has not always been appreciated in modern science until recently. It has become appreciated now, where we have this science of chronobiology, which has taken off in the past 20 years and has affirmed what the Veda practitioners have been telling patients for much longer than that. So we have biological clocks, and the main timekeeper in the physiology is in the brain, is in the suprachiasmatic nucleus. And then we have peripheral organ system clocks, which take the central timekeeper takes its cues from the sun through the retina. The peripheral organ systems take their cues in other ways. In the case of the gut takes its cues from when you eat. So if you're eating at the correct time, and the gut knows what time it is and knows what to do and is in sync with the central clock. But if we eat at weird times, then the gut clock gets out of sync with the central clock, and metabolic dysfunction is the result. And this is well documented. So here we see there's a lot of data. People haven't directly studied necessarily the Ayurvedic routine, but indirectly they have. So there's a lot of, this is a very popular thing. Many of you have seen the data on time-restricted eating, where people will tell patients, eat between noon and 8 p.m. Now, if you eat between noon and 8 p.m., then you don't eat again until noon, you're going to be starving at noon, and lunch is going to be your main meal. All right, so, and these are data published in the Annals of Internal Medicine in 2023, comparing time-restricted eating to caloric restriction to control. And you can see here, this is the control group, and the time-restricted eating is the orange, and it's about the same as caloric restriction. In other words, if you want your patient to lose weight, you can tell them to restrict their calories, but if you just tell them to have your main meal at lunch and not to overeat at night, they'll do just as well as what the data suggests. Okay. There are data, we know that gut motility is better during the day than at night. There are data showing that insulin levels and plasma blood sugars go higher at night or lower during the day. In other words, if you take a group of patients and you give them X meal at noon, and you take the same group of patients and you give them the same meal at 9 p.m. Same people, same food, different time of day, well documented that blood sugars and insulin levels will go higher at night. If you take people, as these authors did, Sohn and colleagues, and if you expose them, experimental subjects, to bright or dim light, bright light or dim light, those exposed to bright light show evidence of improved carbohydrate absorption and stomach muscle electrical activity. Cross-sectional epidemiologic data show that eating late at night increases your risk for heart disease, obesity, and metabolic syndrome. Exercise timing. So these are descriptive data, survey data. When do people exercise? And this is the diurnal pattern of moderate to vigorous physical exercise, published in 2023. Okay, sorry. All right, and what you can see here is that there are 3 peaks. In other words, descriptive data from Americans. There are a bunch of people who exercise early in the morning, and there's a bunch of people who exercise sort of midday, and there's a bunch of people who exercise at the end of the day. And what the next slide shows, the people who exercise early in the morning are the lower solid line. This is total amount of, the x-axis is total amount of vigorous exercise, and the y-axis, BMI. At any BMI level, at any exercise level, however much you're exercising, those exercising in the morning versus later in the day, it's associated with a lower BMI, a lower body mass index. And I'm not even posting all the data on night shift work. The World Health Organization has published a 400-page monograph on night shift work and considers night shift work a carcinogen associated with heart disease, stroke, obesity, and the like. Okay, sesame oil we use for abhyanga and many other things. Many documented benefits of sesame oil as an antioxidant, as an anti-bacterial agent, as an anti-pain agent. There are many studies showing that sesame oil mouthwash improves indices of dental hygiene and dental health and so forth. Okay, so that's a quick look. Oh, and I'll just mention that in Panchakarma, there's very little data in the United States. So this is an area where we need help and improvement. These are data that were published 20 years ago, comparing people at our institution at MIU who went to the Raj at Maharishi International University in Iowa and at Panchakarma, and comparing them to matched controls and looking at their pesticide levels, and we can see reduced levels of PCBs in those who had been through Panchakarma versus the controls. Okay, I'll take a break for limited question. Any question about what we've said? Yeah, go ahead. Go ahead.
The exposure to sunlight was post-lunch, post-midday lunch, or was it pre-midday?
The exposure to which?
The exposure to the sunlight was post-meal or pre-meal.
You said it is bright, exposure to bright light.
Right, that's exposure to bright. I don't think that was sunlight. I think that was artificial light. No, I don't think that was sunlight. Yes, that was an experiment.
And that was, I mean, the sunlight exposure to sunlight was before the midday meal, or was
No, I don't think they had an. Why isn't that working? Okay, it's not going back. Why aren't my slides going back?
I will do that. Yeah, I will do that.
Yeah, thank you. No, I don't think that was, the outcome measures weren't related to food. I think they were measuring the physiology of the stomach, the electrical activity in the stomach. Oh, but there was carbohydrate absorption, you're right. So, gosh, it must have been before a meal. I have to go back and look. Okay, any other questions about, yes, yes. Well, but in this by implication, but in this experiment, people were not sunning. They were inside being exposed to light. But in general, the idea being is that there's something with that the light impacts our, which we can all believe, that the light impacts our digestion. Well, I guess, yeah. I mean, yeah. Right, we connect with the light of the sun. When the sun comes up, wake up. Sun goes down, go to bed. When the sun's highest in the sky, eat, and that's how we're programmed. And we're just trying to, we're showing some data which is consistent with that. Yeah.
So about the intermittent fasting he was mentioning.
That's a different issue. So this was a study design where they're studying a time-restricted eating, which is a little bit different than intermittent fasting, I guess. So that's how they're organizing those studies. Now, the clinical question of whether someone should skip breakfast or not depends on the patient. But that's how that study was organized. Depends on the person. Okay, so the question is being raised. I'll answer this question and we'll move on. Morning breakfast should be heavy. This is not what we think. So there are some people who think breakfast should be the main meal. And that would be the case, I guess, if you were like a doctor or a school teacher in the United States, you didn't have time for lunch. But it's not the ideal because Agni is not as strong. The digestive fire is not as strong. So the main meal should be lunch. When the sun is highest in the sky is when nature supports our digesting our biggest meal, according to Ayurveda, according to chronobiology. The problem with eating too much breakfast is then you're not hungry for lunch, and then you eat too much dinner, and then you're subject to all those other problems. Okay, I'll talk, yes.
So there are sort of two components of Ayurveda as we understand, as far as the application is concerned. So one is, of course, the well-being, wellness, which you talked about, the timing of the diet, sleep, circadian rhythm, and whatever else, right? So that is well understood. And my question is about the therapeutic part or treatment part, right? So well-being, wellness is one, therapy for the patients is the other part. So I'm curious to know in your practice, which group of patients with which diagnosis you would think would benefit most, or in which conditions, which diagnosis that you label to the patient would benefit most, or you would be tempted to offer them Ayurvedic options compared to the risk-benefit ratio of the Western medications and what we know of in the chronic disease pattern. As a primary care physician, as a sort of internist, you would see, and you'll be tempted to offer them Ayurvedic option, and you think that they will benefit more with Ayurveda rather than conventional Western medicine.
Okay, so the answer, it's a very good question. Number one, if the patient wants Ayurveda, that's going to help it work. So anyone who comes in with that agenda, if it's not inappropriate, then we'll do it. And then there are just so many areas where the primary care doctor just can't do anything. Chronic musculoskeletal pain, the full spectrum of routine primary care gut disorders, from esophageal reflux to irritable bowel syndrome and constipation, depression, anxiety, chronic stable angina, poorly controlled hypertension, anything where the allopathic care just isn't cutting it. Yeah. Okay. All right. So let's. I want to mention. Yeah. Okay. Okay, one more question and then we'll go on. Yes, go ahead.
Yeah, Ayurveda pharmacy is there.
Ayurveda pharmacy?
Pharmacy is there in USA.
No, what we need,
Whether the Ayurvedic medicines are available any state of the USA.
so in general,
Second question, Mike, does it relate the Ayurveda with the other medicine, Unani system, homeopathic, and the third one is actually
Allopathy.
so, okay, so Ayurvedic pharmacies, no. People mail order, I mean, some practitioners in the United States might stock Ayurvedic herbs, but people, our patients mail order the herbs. And we send them to reliable websites. So that was the first question. And then I wasn't sure if I understood the rest of your question.
naturopathy. Third one is the naturopathy.
There are naturopathic docs in the United States. There are naturopathic schools. I think there are 7 of them that are recognized, and maybe half the states license naturopaths. And some of these, so in Portland, where I used to live, there's a naturopathic college that had a naturopathic pharmacy, and you could go there to get some of the Ayurvedic single herbs. Some of them are grown in the U.S. Some of them are grown, yes. Okay, I want to mention.
Question is that they ask for the prescription of the medical practitioner in Ayurveda to any allopathy from the Indian doctor when we send the medicines to the US or any kind of other countries also. They are asking for that.
I'm not understanding the question. So,
Medicine, that's a different story. I mean, that's the answer. He said when they send the Ayurvedic medicine from India to the US, they are not allowed. But that's a different question.
that's a different story because we have
Myself is Dr. Matthew. I am ex-professor, principal, and hospital in charge. I am MD by Agro, and I am servicing 40 years more. But my question is, all medicine is sent back.
it's sent back.
Let me answer that question.
Yeah,
Liquid only is on.
For any medicine to be more in the industry, they have to
yeah. There- we- Yeah. I'm going to move on. Let's move on, and we can come back to that issue about getting herbs into America, which the supply chain is a big deal, especially during COVID. It was almost impossible. I want to talk a little bit about the research environment in the United States around Ayurveda, and I'll tell you about a study that I'm working on now that's funded by the NIH. So this is from the website of the National Center for Complementary Integrative Medicine at the National Institutes of Health in the United States. And we're very grateful to this institute for funding a lot of research in integrative medicine, including studies I've worked on. But I want to show you what they said, and don't get upset with me. I'm just reading what they said. Okay, Ayurvedic medicine in depth. This is right off their website. These are the people who fund our research. Well, I just accessed the website a month ago. It was last year. Okay, wait a minute, what happened to that? Okay, is Ayurvedic medicine safe? Some Ayurvedic preparations may contain lead, mercury, or arsenic in amounts that can be toxic. All right, so we know that can be true, and people have to be careful about their suppliers. But this is really silly because Ayurvedic, it's safe. I mean, people come to, we saw, one of the reasons people come to us is for integrative care, or is because it's safer. I mean, turmeric is safer than ibuprofen, plain and simple. Ashwagandha is safer than diazepam, plain and simple. So this is weird, but I just wanted to show you that this is what the environment is like. It's a little difficult. How much do we know about Ayurvedic medicine? Although Ayurvedic medicine and its components have been described in many scholarly articles, only a small number of clinical trials using these approaches have been published in Western medical journals. Wait a second. We just spent 15 minutes just skimming the surface of all the data and all these modalities that Ayurveda practitioners commonly use. True that in the United States, there's not much data on Panchakarma, but so I just wanted to show this slide that we have a lot of work to do in terms of our image, I guess. We talked about that. So one of the things that we're doing as in an effort to do research that we recognize as Ayurveda, is we are doing research that we call, there's a movement or a discipline within integrated medicine research called whole systems research, where we study an intervention as a multimodality package. So rather than studying ashwagandha or studying TM or studying diet, we take a clinical protocol that encompasses all the modalities that we might want to use in an Ayurvedic clinical encounter, and we compare that to a control group that's matched in terms of intensity. So this idea of doing studies that are both clinically authentic and rigorous, we call this whole systems research. And it's tricky because when you do a randomized trial, it has to be a protocol because it has to be reproducible. But when we do practice Ayurveda, it's by definition individualized. So what we have to do is thread the needle and develop protocols that are rigorous enough to satisfy the scientific community, yet allow the practitioner enough leeway to be authentic. Dr. Leslie and I published one such study 20 years ago among diabetics. We recruited 60 diabetic patients at Kaiser Permanente, newly diagnosed, and randomized them either to allopathic health education or a multimodality Ayurvedic protocol, including transcendental meditation instruction, an herbal supplement, an Ayurvedic diet tailored to the Vikriti, to the body type exercise. And you can see the improvements in fasting blood sugar compared to the control group for the Vedic group. I now, 20 years later, have the privilege of working with a colleague of mine, Dr. Anand Dhruva at the University of California, San Francisco. And we're doing a study comparing Ayurveda to health education for breast cancer survivors with quality of life outcomes. And the study is taking place at 3 sites, UC San Francisco, Kaiser Permanente Northwest, and Vanderbilt University in Nashville. And what happens is patients who are breast cancer survivors and are done with their treatments, but they're not doing well. So when would you use Ayurveda? Here's a great example, because the cancer survivorship, it's a very difficult area for the allopathic doctors, the oncologists. So the oncologists welcome these studies because it gives them potentially more tools. And so the participants are randomized to a health education module or to see an Ayurvedic practitioner. They are diagnosed by an Ayurveda practitioner. And first we had to develop a diagnostic protocol and document that the practitioners were independently achieving concordance with one another, that they would agree on the diagnosis, that we could get practitioners to agree on a diagnosis. And then The treatment protocols consist of 4 modalities: diet, behavior modification, marma, and yoga. And within those 4 modalities, the practitioners have some flexibility, depending upon whether it's vata, pitta, or kapha, depending upon whether it's ama or not. Okay, so that study is ongoing, and you can look for the results of that research program down the road. And more studies like that are needed in America to get our story told. And we need more research on panchakarma, and that will require cooperation and funding from other sources, because our government in the United States is unlikely to fund it, I think. Questions or comments on the research scene before we move on to training? Keep going. All right. I want to mention that at MIU, as I mentioned, leading center, Ayurvedic research, Ayurvedic training, Ayurvedic education. And these are some of the theses. We have a PhD program, and these are some of the theses that our doctoral students are doing. I showed you one that's just getting rolling, but we've had others that have been published or been submitted for publication on TM for emotional intelligence, Ayurveda for depression, Ayurveda for cancer survivorship, and the like. We have a fellowship program, and our fellows are doctors, and they do capstone projects, have done some very interesting work. One of our fellows last year did a systematic review of Ayurvedic herbs for osteoarthritis. Another collected data showing the impact of integrative Ayurveda fellowship training on physician performance. Very interesting, and the like. So I'll tell you a little bit about our fellowship program. It's for doctors. It's 2 years, online, part-time. It is recognized by the American Board of Integrative Medicine. So the fellows stay in practice, and they work about 10 hours a week online. We have a webinar every other week on Zoom, and they come to campus 1 week each of the 2 years. And when they're done, they're eligible to sit the certification exam offered by the American Board of Integrative Medicine. And the curriculum consists of 2 parts. Half of the curriculum is general integrative medicine. It's the Western approach to holistic care. We get that curriculum from the University of Arizona. We license curriculum from them. And the Ayurvedic component of the curriculum comes from us, of course, at MIU. And it's very practical clinically. People learn skills which they can integrate right away into an allopathic practice. And it's very focused on self-care. Everyone learns transcendental meditation. Everyone learns the routine, the diet, and we learn and we do these things. We go through herbal protocols. People use the herbs on their patients, on themselves, on their family, and we learn and we grow this way. And so the fellowship is intended to be personally transformational for the clinician, for the physician. One of our fellows, in one of her assignments, she wrote that when I'm doing my homework, I'm healing myself. And this is how we like to educate our patients, our doctors. Okay, and these are the modalities we teach people: diet, herbals, mind, body, 5 sense therapies, aromatherapy, massage, and the like. Exercise, pulse diagnosis. We spend a lot of energy teaching our doctors pulse diagnosis. Evidence-based referral guidelines for other interventions. And this program is a great success, and we graduated our first class this past June. Okay, the last thing I'll talk about, I think, is what the practice models is like, and I'll tell you a little bit about how I integrated Ayurveda into my practice in a big healthcare organization, and then some of the things that fellows are talking about doing in some direction moving forward is the way I managed. So I worked at Kaiser Permanente. This is a big HMO on the West Coast of the United States. It's, we have 13 million members. It's the largest non-governmental provider of healthcare in the world, actually. And what I did was I set up a referral-based clinic where anybody who wanted holistic care would be sent to me. And we had everybody, their first appointment was a group clinic. It was a class. We'd have 10, 12 patients come at a time. And they would learn about Vata, Pitta, Kapha, Ojas, Ama, Agni, the basic principles of Ayurveda. And then they would learn the basic daily routine and the guidelines for proper digestion. And that would be 2 hours. They would leave. Then they'd come back for an individual consultation. We'd take their pulse, do a full assessment, and give them an individualized protocol. That was very effective, and we did that. I did that for 25 years at Kaiser Permanente, and it was very well received by all the specialists. The gastroenterologists would send us their functional bowel patients. The pain clinic would send us patients. The oncology clinic would send us patients to manage the side effects of chemotherapy, and so on. We had great cooperation from our specialists. At MIU, we do have one Panchakarma center on our campus, the Raj, where we're doing full service Panchakarma. But what we are looking to do is to combine that with an allopathic primary care practice. And I think that's where in America we need to go is, first, that's the next step, the next hurdle. And that's going to take a lot of research and a lot of time, because a lot of the modalities of Panchakarma in India, people have, okay, it's part of the culture. In America, Basti is not part of the culture, right? Vamana is not part of the culture. So it's going to take some time. Okay, I just summarize what we said. Why are integrated medicine and Ayurveda relevant for allopathic doctors? The history of use, the burden of chronic disease, the economics, all the conditions where allopathic medicine falls short, and the other points we made. And we have said that there's a lot of data in the West on individual Ayurvedic modalities, except for Panchakarma. For combination protocols, there's only very limited data. And we just talked about how we're practicing now and in the future. And the fellowship training program that we have, and here's our inaugural group of fellows who just graduated, really is very cutting edge. It's the only fellowship program of its type in the world as that we're aware of, certainly in North America. And here you see our wonderfully talented doctors who are the next generation of integrative Ayurveda leaders in the United States, God willing. Thank you. And we have time for questions.
Yeah, thank you, Dr. Elder. Now, I would like you to ask few questions in a slightly different way. Yeah, would you like to? Yeah, because you are already.
Thank you.
So basically, like if I am a patient and I have a problem of what we call it a reflux disease, acidity. If I come to you, you know both the system, you know the Ayurvedic system or the integrative medicine, and you know the allopathy. So what will be your suggestion? Forget about what I want. What will be your suggestions as an expert doctor to me?
Right, so that depends. One of the things that I would say is that one never completely forgets about the patient, because first of all, why is the patient coming to see me? Because if a patient comes to see me because they want Prilosec, and instead I give them an herbal supplement, instead I tell them to drink aloe vera juice, they're going to go complain. So I have to figure out where the patient's coming from and what the patient wants. And so it's a combination of things. So sometimes if the patient is there for a drug and there for allopathic care, the patient's going to get that. We might try to work with their diet a little bit if I sense that they're up for it. Okay, so when are they eating? What are they eating? Can I talk to them about a pitta balancing diet, even if I don't call it that? Okay. Now, if the patient is there for, the patient comes to see me because they've heard that I'm the integrated medicine doc and they want Ayurveda, that's another story. So then, again, we talk about their diet. We might recommend mind-body technique to reduce stress. When are they eating? What are they eating? What is the routine like? We could give them a supplement, Avipataka Churna, or some other relevant supplement like that. And of course, we always want to make sure that the patient has been worked up properly. Does the patient need a CBC? Does the patient need endoscopy? If they don't, they don't. But if they do, they need to get it.
Okay, so basically, you will carry out an evaluation of the patient, and then you will try to understand what patient wants. But ultimately, when it comes to the treatment, how would you treat it? Yes, we accept about the lifestyle modification. Yes, that's the pyramid at the bottom of the pyramid. But what about anything else?
Right, so lifestyle modification, herbals, mind, body, potentially.
Okay, so which herbals you would suggest?
So it might be Avipataka Churna would often be an appropriate.
Yeah, I mean, would you be able to convert that into the Gujarati language, or the one which is very commonly understood by us? Yeah. Okay.
Yes, yes. So this is my pronunciation is not very good.
No, it's not the pronunciation.
Oh,
It's
yes,
basically
it
the
is a
technical
pronunciation
name
too.
is probably we are not able to
No,
understand.
no, and I don't say it very well. And then there are other aloe vera juice. Can be
Okay,
very
aloe
good.
vera juice.
We can tell the patient to chew cardamom seeds. Okay, we can tell the patient to use in their diet cooling spices, saffron, coriander, fennel, like that.
Okay, good.
We tell rose water, rose petal jam, rose containing products, cooling stuff.
Okay, great. Yeah, so Amit bhai, would you like to just make it easily understandable for our
Thank you. I think Dr. Elder covered most of the thing, but I would kind of put it in slightly different way. The first thing, and I can talk from the grounds up or where rubber meets the road, because I have a private clinic. So you are describing somebody's coming to me with the upper GI symptoms. We call it acidity, peptic ulcer disease, or GERD. The first thing is slightly go back, that is the acidity is the only problem, or there are some other issues, meaning thereby why allopathic physician needs to learn about Ayurveda, because it takes even to a higher level of homeostasis or internal medicine, systemic thinking. And the reason I'm thinking, why I'm saying is, it's not about acidity. We need to learn about, allopathic physician need to learn about the functional or systematic pathophysiology. And because the acidity, from not only Ayurvedic point of view, and I don't think Ayurvedic or allopathic in a different way. I don't think in a dual pathway. It is actually a non-dual science. But I'm coming to the acidity part, because most of the time acidity is part of the pitta imbalance, and we need to pacify pitta. Now let me talk about pitta, vata and kapha, because this will come up again and again. So if you think from allopathic point of view, when we learn about anatomy and physiology, we learn everything, right? That's our first MBBS. From Ayurvedic point of view, vata is movements, pitta is metabolism, kapha is structure. Now think about it. Is there anything else in allopathy other than these three things? If you talk about body, our anatomy and physiology, it is all about structure. There are movements. When I say movements, means there is a nerve impulse movement, there is a GI motility, there is a circulation, there is a hormone secretion and its movement. So it's all about movement. That movement is vata. Second thing, everything else is metabolism. So there is a movement, there is a metabolism, and there is structure. There is no other thing, even from allopathic science, other than these three things. So when we talk about anatomy and physiology, Ayurveda talks about vata energy, pitta energy, and kapha energy. And we have to look the acid problem or acid peptic problem as a pitta imbalance in a way. So from Ayurvedic point of view, pitta imbalance not only causes the acidity, GERD, but it also is related with frequent migraines, skin rash, eye problem, anger problem, cardiovascular problem. These are all long-term pitta imbalance problem. So many times you will see the package of diseases. So it's when somebody comes with acid peptic problem, I want to know more about, do they have migraine headaches? Do they have a skin rash problem? Do they have eye problems? How about cardiovascular problem? So then in the management of the patient, it's not about only stomach. It's about the whole body, whole person management. That means the pitta pacifying lifestyle, pitta pacifying diet, pitta pacifying time of the diet. In addition to that comes all the herbs which Dr. Elder already suggested. And this is my personal experience, that this was the actual reason which attracted me for Ayurveda, because many years ago, every day I had a GERD and peptic ulcer problems, and I used to take our products which comes as samples. So I used to use that more and more. Nowadays, I keep in my car funnel seeds and coconut flakes. These two are actually pitta pacifying herbs which are easily available. They have a pitta pacifying chemical properties. What are the other herbs? He already mentioned about rose petals. Another big thing is Tak Maria. You all probably know in a Faluda, we have that dessert. The Faluda seeds are actually holy basil seeds. That Tak Maria, when you put Tak Maria in the water, it forms a nice white layer around it. That white layer is a stomach stabilizing chemical compound. So I'm just talking about Tak Maria, rose petal, funnel seeds. He mentioned about the aloe vera. These are all pacifying, pitta pacifying thing. So while and you will see in the practice that Prilosec and Protonics are not sufficient, because it only works to reduce the acid secretion, but there are some other long-term side effects also. So instead of that, I think Dr. Josipura asked the question, what I would do when patient comes. My first suggestion would be to diagnose the pitta imbalance or imbalance. And in Prilosec, I would have them as a PRN. My actual treatment would be this. Now, I also want to answer your question, how the medical legally nowadays this thing can be practiced. I think that was one of your questions which probably need proper answer. So as an integrative physician, what I do is I can put some of the Ayurvedic practitioner under my practice umbrella for malpractice. And they can suggest to me and I can suggest to them what are the compounds can be prescribed. So I may not be expert in some of the Ayurvedic formulations, but I can utilize the expertise from the Ayurvedic physicians, which I can suggest to them that these are the combinations can be done. But so medical legally, these things are covered. So that is about some of, it may not answer your all question. We can probably address it separately. But coming back to this acid problem, these 5-6 compounds are so easily available. Now we talk about evidence based. Now who is going to do the actually double blind control trial on funnel seeds? Because there is no money. Unless the government is going to fund, some of the time, many times we talk about evidence based, but where is the, if there is no money, pharmaceutical companies are not going to do those studies. But anyway, come back to the acid peptic problem. We can talk about some other disease process, and diabetes is one of them, which I use, that if in a pre-diabetic phase, I do the same thing, because diabetes is, to many degrees, is a kapha imbalance or a inappropriate, some of the agnis. When we say agni, it's metabolism. So we can talk about that, what I do in the pre-diabetic phase, that I heavily suggest the Ayurvedic intervention, even before even starting metformin.
That's in the pre-diabetic stage. When the person is in the diabetic stage, already taking some or the other medications.
So say for example, patient has a diabetes, hemoglobin A1C of 6.6. I will come back to you. Say for example, the patient is diagnosed diabetes, hemoglobin A1C 6.6, reasonably still early diabetes. If hemoglobin A1C is more than 7.5, then I immediately jump on the allopathic treatment. So even between hemoglobin A1C of 6.5 to 7.5, I discuss with the patient first that yes, there are some other alternative therapies. Would you prefer this or do you want to do this? And if you document it properly, then you are covered, because you have actually discussed with the patient, and patient is opting for alternative or non-allopathic treatment. At that time, there are very effective diabetic preparations from Ayurvedic combinations that are available. And I'm sure Dr. Prerak Shah knows about it. And there are studies have been done, GlycoCare, Glycostate, a lot of such companies, even MAPI has a glucostat. These are the combination of 5 or 6 different herbs, and they will work in the early diabetic phase along with the diet and exercise and lifestyle. So I don't see that prescribing even in the early diabetic phase. So as an allopathic physician, yes, my aim is to make sure the patient does not develop any complications. There is a discussion going on, what is their preference versus not, and not prescribing metformin after discussion is not going to be a malpractice issue, because we have discussed. But yes, between early diabetes, there are plenty of Ayurvedic products available, should be tried, and there is nothing wrong in it. Again, always diet, and the Dincharya is a brilliant science. It is not just a philosophy. 2017, actually, there was a Nobel Prize actually on a biological clock. So this is no more some kind of fringe or philosophical or moral issue anymore. I think there are plenty of evidence-based, scientific, evidence-based literature available for us to adopt very intellectually conceptualized science in our day-to-day practice.
So good. So you explain about the acidity part. You explain about the diabetes, the early diabetes part. The next condition, which is very common in our society, is the blood pressure. So what will be your approach in that? It will be something in similar, like up to certain range of blood pressure, you would think of lifestyle modification plus something.
Yeah, the best evidence-based intervention from Ayurveda for high blood pressure is transcendental meditation.
Okay, the meditation part.
It works. So any patient should learn at any stage of high blood pressure should be advised to learn TM.
I think the mindfulness program is also found to be.
Mindfulness is also, there's also data for mindfulness. the statement that was recently came out from the American Heart Association mentioned that mind-body medicine can be appropriate for high blood pressure, but only TM was mentioned specifically as having the best evidence.
Okay, good. Yeah.
So as far as blood pressure is concerned, personally, I have not found a particular Ayurvedic intervention. I'm talking from the herbal point of view. So what I do in the practice is, of course, mentioning about diet, the dosha balance, the lifestyle, the meditation. But if there is a simultaneously other risk factor, I immediately go in the allopathic prescription. Especially someone has a history of also concomitant diabetes, say for example. So I would actually jump on ACE inhibitor low dose. Of course, while this lifestyle and all those things are supplemented. Because personally, and maybe it is because of lack of knowledge or experience or lack of certain studies, I do straight jump on prescribing ACE inhibitor, especially someone is diabetic or has a cardiovascular problem. So as an integrative physician, our goal is, it's not about this pathy versus this pathy. We don't need to be in the business of proving or disproving whether this allopathy or this Ayurvedic is good or bad. That is not our job. Our job as an integrative physician is to look at the whole patient, see what are things are available, and rather than proving or disproving, let's just go on the evidence base, how you feel comfortable, how patient feel comfortable. But this is what I do in my practice. As far as blood pressure is concerned, I would go straight on a treatment side, other than in addition to all these modalities.
In addition, there are different subsets of blood pressure. So there's Vata high blood pressure, and there's Pitta high blood pressure. And so if the pulse, the Vikriti, if the imbalance is Vata, then and the patient has associated symptoms, a whole set of things to balance Vata dosha, not necessarily focus on the blood pressure, but the blood pressure should come down as the imbalance is corrected. So aromatherapies, diet, herbals, herbal teas, spices, and the like that balance Vata. If it's Pitta, a different set of cooling. As Pitta hypertension, the patient's angry and overheated.
Yes.
Different types. So those are, yeah.
So basically, I don't see why an allopathic physician should not learn about dosha. It is so scientific and it can be so easily integrated when you are treating diabetic patients or anyone else. And I'm just saying that I don't see a conflict. In fact, I feel like now, allopathic physician not knowing dosha is actually a big problem. Because I think they are actually not doing a proper justice to the patient. If healthcare system is designed for the patient's well-being, not knowing the scientific evidence and so much complementary process which will help the patient, I think not knowing the dosha, which is perfectly based on pathophysiology, bioenergy, actually is a disservice to the patient. So that's why the allopathic physician must learn about scientific foundation. Ayurveda is not about ashwagandha and turmeric, and that comes much, much later. I think one must learn first the scientific foundation. So that's just what he was mentioning.
Just like before we take some audience question. Yeah, Sunil, please.
Can you throw some light on pulse diagnosis?
So,
Dr. Elder can mention first, and then I will.
What was the question? What is pulse diagnosis? Okay, so according to the Vedic texts, one can learn everything you need to know about the patient by assessing the radial pulse. So we take 3 fingers, place the index finger just proximal to the radial styloid, and then the middle and the ring finger. And in brief, the Vata value is felt here, the Pitta value and the Kapha value. And one can learn by assessing the pulse, and it's not rocket science, I can be trained to do this, to assess what the imbalance in the pulse is. And the reason is, this is very powerful for a number of reasons, but for us, one can then detect imbalances in the physiology before they arise as disease. So in Ayurveda, there are 6 stages to disease. The dosha starts, everything's fine. The dosha starts to accumulate, too much of it. And then it becomes aggravated. And then it disseminates. And then it deposits where it doesn't belong. And then it manifests, and then it disrupts. So with the pulse, in allopathic medicine, we can pick up disease stages 5 and 6. The patient's sick. Pulse diagnosis, we pick up that imbalance in the early stages of disease and can prescribe a preventive program that's tailored to the patient before the disease manifests.
I will give you.
And what's the inter-observer reliability of pulse diagnosis?
So, pulse diagnosis is very subjective. This is my interpretation. So it requires tremendous training and whatnot. I'm talking from practicing physician point of view, and I took actually a pulse diagnosis course also under Dr. Lard. And I think with some practice, I think one can pick up what level of imbalance, whether currently there is a Vata imbalance or Pitta imbalance and whatnot, and which tissue. So in the pulse diagnosis, in allopathic way, we learn about rate, rhythm, volume, irregular, things like that, right? In Ayurveda, the pulse diagnosis is much detailed. It has a 7-layer of pulse feelings. So when you feel the pulse very superficially, that's a different characteristic. And when you feel the pulse at the deepest level before it obliterates, that is the 7th layer of pulse. Between first layer and 7th layer, there are 5 more layers. So you can imagine how much experience and practice it needs, but every layer tells a different story, basically. And someone who is so much expert, I think, can diagnose which dosha imbalance in which part of the tissue, whether it is fat tissue or reproductive tissue or whatnot. So that requires a tremendous thing. You talk about the reproducibility. So there have been now actually a lot of interest with a lot of this digital technology and to digitalize the pulse diagnosis, I think, which will take 5-10 years to have a better reproducible or whatnot. So pulse diagnosis.
Couple things. There is one of our Vajas at MIU did publish a paper showing the accuracy of pulse diagnosis in the setting of determining different types of hypertension. Very little work has been done on the reproducibility of diagnosis. Now, I will mention that in the oncology study that we're doing, we are assessing and documenting the reproducibility of an Ayurvedic diagnosis, which includes, but is not limited to, pulse diagnosis.
But yeah, so that requires, it's a work in progress.
Any question? Yeah.
One question and one comment. One is any expansion of the herbs which have been written in Ayurveda, because there's so much of other things. For example, cannabinoids or cannabis derivatives and psilocybin. There has been a lot of research that on mental health now. So any work in that direction. And second point was, we said who will do research? I think governments, private foundations, philanthropists, we see who will develop temple. There are many people who develop temples and give crores of rupees of temple. Who will develop highway? Government develops highways. And we have very strong belief in Ayurveda. And there is this new center coming up in Jamnagar on alternative medicine for WHO's collaborative center. My recommendation is they should take up 5 or 10 practices or herbs or whatever every year and do double-blind trials and prove in next 20 years some 100 new confirmed scientifically, Western scientifically proven Ayurvedic, whatever you want to call it, practices, and not build buildings and buildings and buildings, because most of the Indian centers of excellence build buildings rather than doing trials. So I think we have to develop this scientific mentality, saying fund research rather than funding belief, because we are currently funding belief. So these are the two, one point and one question about mental health and other cannabinoids and psilocybin, etc.
Yeah, excellent suggestion. Yeah, we need to change the mentality and to
So
be.
I'd like to comment on.
Yeah.
So I have an opinion, you know, I think,
Yeah,
so
you can take this one. You can take this one.
one second. Yeah, so things are always evolving. And in our fellowship, we have an integrative medicine component, and these are popular topics, the cannabinoids and the hallucinogens and psilocybin. It's not my favorite intervention. Now, for some patients, okay. I do not like to prescribe cannabis except in the setting in hospice care, the dying patient for pain management, of course. So there are some settings where that can make sense, but it has, you know, it can have a negative effect on one's consciousness. It clouds the consciousness. So it might have a good short-term benefit. This is my opinion, but the long-term effect on the patient might not be good. That's my opinion.
Yeah. This will be the last question because we are already close to the.
First of all, my congratulations for the organizer, and as the name suggests, this is integration of allopathy, Ayurveda, and other therapies, and it has been rightly done because we are having already an integration American, Indian American, and Indians. So very nicely done. And a few points. First of let me introduce myself. Amit knows me, but I'm for the other people, and I'm an endocrinologist based in Ahmedabad, trained in modern medicine, and then in France, and then once again back to our country. Since I'm closely associated to endocrinology and also alternate medicine, so I decided to come here. And few things, any therapy or any disease or any problem needs three things: diagnosis, prevention, and treatment. So all the pathies or all the model of, modalities of treatment, they are having some strength and some weakness according to current year 2025 or 2026. For example, Ayurveda, we largely, decide on this pulse diagnosis, or as Dr. Amit explained and Dr. Elder explained about the tridosa. As Amit already highlighted, it's a very valid point that we don't know anything about. We, as an Indians, we know that there is tridosa, and at times I felt that I should see maybe Dr. Peraksa or somebody else that he can identify if my all dosas are correct or not. So it will be nice that we get some training and understand, and we can incorporate in our training. Still, we will be very much limited in diagnosing many of the problems through only Ayurveda. So we would need help of modern medicines. Then second thing, there are differential responses of similar therapy in a same, disease, like for diabetes. I can give some example also, but because of the paucity of time. Same diabetes, HbA1c 11.5, one person with same Ayurvedic preparation responds dramatically and goes into severe hypoglycemia. One of the famous cardiologists of Ahmedabad, his mother, she went into hypoglycemic coma, not once on 3 times. And in spite of all other medication going on, insulin as well as OHA, she was not responding and some Ayurvedic medicine. Her daughter-in-law, who is also a modern medicine doctor, ophthalmologist, she took same medicine, no response. So there is a differential response of Ayurveda. Another thing is research. Unfortunately, as somebody mentioned, there are very limited research in this field. And if there are research, it may be, phase 2 or phase 3. There will be always some limitation of phase 1 studies. That means identifying how the mechanism of action of any, intervention you are using. So how we are going to, address that. Last but not the least, I was also associated with some of the medications or Ayurveda way of treatment of diabetes. Mameja, I don't know how you translate in English. And so that was studied phase 1, 2, 3, and it showed there was effect, but in some patients, not all, but there was also impact on DNA. It modified DNA in favorable, and there was a better effect. So these are my few observations. I came here with lots of confusion. I had still many confusion, but some clarity.
I'd like to comment a couple of your points. The studying the trajectory for if somebody wants to bring a drug to market. So somebody synthesizes some drug in their lab. Is it a panacea or poison? Who knows? Phase 1, phase 2, phase 3. You need to go. In the case of Ayurvedic interventions that people have been doing thousands of years, it's another story. So while it's interesting to go back and track the mechanism, it isn't necessarily where one needs to start to do the research, even with the herbs that people have been using for so long that they're presumed safe. And so it's a different set of questions that I think you're answering, that you want to answer with the research. Yeah.
Just to add one thing about the research component, when we do, and by the way, I'm a principal investigator now of almost 75 different allopathic trials, phase 2, phase 3, and I know that how the modern medicine research works. One of the issue is that in allopathic research, we talk about double-blind, placebo-controlled trials. We assume that all 100 patients have a same bioenergy and pathophysiology energy, which is not the case. We talk about personalized medicine. Out of 100, there is so much variety of bioenergy. And when I say bioenergy, it's not an abstract word. Metabolism. What I mean by there are slow metabolizer, there are fast metabolizer, and there are varied metabolizer. Slow metabolizer are primarily kapha. Fast metabolizer are classically pitta. Varied metabolism is vata energy. So within even our evidence-based research, we just automatically assume that everything has to be same. All 100 patients are same because their age is within the limit and they have this set and this set, but there has never been personalized. The dosha concept must be part of the allopathic medicine. That is only where the allopathic medicine actually will advance. That is the very reason why all the allopathic physician needs to learn about this dosha concept. That I think we talk about the products, that comes later on. This scientific foundation of pathophysiology, who are the fast metabolizer, who are the slow metabolizer, who are the varied metabolizer, vata, pitta. That's the point I'm making. And if I can answer your question about the research component.
They don't. So most clinical trials, they don't tell you who it worked for. It worked, or it didn't work, or it worked or it didn't for everyone. Well, who did it work for and who did it not work for? Which is what you clinically want to know. Usually the drug trials don't answer that question. Now, I do agree with your comment, and we're not arguing. Sometimes one needs allopathic care. This is very clear. And so I think you raised that point. Yeah, of course. But we have this concept that's being alluded to of the body type. So patients have a prakriti, a body type,
Yes.
which is where one of these three or two of these doshas predominate, and based upon the constitution of the patient, this influences how we manage their treatment.
So thank you so much. Before Dr. Prerak Shah gives a thank for all of us. Now I want to just highlight. Initially I mentioned about the historic characteristic of this meeting, because this is not a one event. This is a ongoing process, ongoing movement. Therefore, we see here allopathic doctors, the Ayurvedic community, as well as a lot of other general elite or informed patient, I would say, who are curious. So this is the first time we are combining the involvement of all sectors of life, because Ayurveda and allopathy and these, and ultimately we are all here for personalized well-being. So my suggestion is, please give us your contacts so that we can be in touch going forward, because there is a lot work to be done. We know that allopathy doesn't have all the answer, Ayurvedic Veda don't have all the answers, but what I call for action is this: involve yourself in whichever areas you are, because combined collectively we will be able to change the policy, whether we need a more research funding from Ayush Ministry, or we want to introduce Ayurvedic curriculum in the medical school, and we want to prevent the Ayurvedic physicians not to prescribe the allopathic medicine which they are not supposed to prescribe because they are not trained. All these questions we can collectively answer, and therefore we had created this Ayurveda consortium. So please be part of our team going forward. And I will request Dr. Prerak Mehta to say the vote of thanks.
Let me conclude the session. First of all, respected Dr. Elder, all present doctor friends, colleagues, as we conclude this meaningful session, my heartfelt thanks to Dr. Elder for sharing not just knowledge, but wisdom. Your journey in integrative medicine reminds us that healthcare is not about proving one system right over another, but about serving the patient in the best possible way. You have beautifully showed how modern science and traditional healing can walk together with clarity, respect, and compassion. Many thanks to all doctors, students, and participants here. Your presence shows that you are thinkers who look beyond labels and boundaries and who genuinely care about holistic well-being. This is not my first experience. I've been traveling to more than 33 countries and teaching Ayurveda to allopathy doctors since 25 years. And hundred doctors are learning Ayurveda over the world. And we have now begun. I'm just seeing your responses. I think we have to start some integrative courses under the banner of AMA. Here we have very good platform. AMA, Dr. Prerak Shah, Ayurveda activity. Under this banner, we can start some bridge courses if the doctor shows interest. And finally, I would like to end with a personal thought. In my own journey as an Ayurveda physician, over 37 years of practice, I have learned that wisdom grows when we listen and healing deepens when we collaborate. Okay. Today's session, thank you. Thank you.
So like AMA, that's all. Yeah.